How would you like to heal your spine with regenerative medicine? Dr. Hany Damian will tell us how. And what's so special about Dr. Hany is he's a healthcare entrepreneur and he serves as the CEO and co-founder of Pain Care Clinic, further demonstrating his commitment to revolutionary healthcare accessibility. And in 2024, Dr. Damian purchased BioSpine Institute, where he now serves as CEO, leading a team of 160 professionals, and he is advancing specialized spine care solutions that challenge traditional approaches. So, Dr. Hany, tell us about how can entrepreneurs heal their spine with regenerative medicine, and what does that actually mean?
Heal podcast with Lily Patrascu shares longevity and anti-aging techniques to stay young forever, increase energy, overcome addiction, and live your longest, best life ever. Shared by world's most innovative, alternative, and traditional health thought leaders, healers, and doctors. Discover quantum healing strategies to heal your mind, body, and soul.
So, Lily, thanks for having me. I have the privilege of being a physician. So I am a doctor that I'm still practicing. I still see my patients on a regular basis every week. So I have a full schedule. But I also entrepreneur, CEO, which can move things depending on the patient outcomes, depending on the patient needs, and depending on the new technology that comes. So I have really what you call it hands-on from the bottom up, from the needs of the patient all the way up to making things happen. So that's my first privilege. Number two, I've been treating chronic pain for 20 years. And the way we were doing it's the conventional medicine, injections, medication and whatnot, a steroid injection. And we're getting modest results and didn't really go anywhere. A few years back, I decided let's do more. So I decided to look and have one of the best spine surgery centers in Southwest Florida, which is BioSpine. They're doing minimally invasive, and they've been doing it uniquely for the past 20 years. They're pushing the boundaries with the new techniques and state-of-the-art equipments that they have developed. And we decided to get together. I bought the majority shares, and we decided to push for micro-invasive. So instead of going to a 5 centimeter incision, we're doing now 5 millimeter incision that you go in through a microscope and you fix the spinal cord, whether it's a laminectomy, discectomy, fusion, or whatnot. But I've noticed over the past years that patients that don't get better through conventional pain management and they don't want surgery. So they fall in the middle between the cracks. So what could be done for this? So I dive deep into stem cells, which really opened my eyes into the healing powers of the body. We can actually reduce inflammation in the spine. We can actually help the spine recover. All the arthritis and all the pain will go away. And if there's something that could be done, we inject peptides as well to change and treat the root cause and return the damaged tissues to its original state that was before the damage. And we're getting great results with this. We combine this with genetics, genomics, and we're having great results without even surgery. So surgery is not obsolete, but we leave it to the last option in our
Thank you. Tell us, what are the main causes of someone having to deal with spine issues, and what are the typical illnesses that are kind of like that patients that you tend to see? What do they suffer from, and what kind of causes those kind of spine issues?
We've all heard patients saying, I put my back out. There is nothing like that. There is nothing called putting my back out. You strained your back. You strain the disc, you strain the ligaments, which is the most common cause, which is mechanical back pain. We lift something heavy in the wrong position and the muscle get into spasm, and then the spasm cause inflammation, and this inflammation starts a process of arthritis or put pressure on the disc. If that's not treated properly through physiotherapy or chiropractor or proper exercise, that develop into quite a bit of arthritis. And usually what happens is it dislodges the disc between the vertebral bodies, whether it's herniation or bulging disc. And there's a huge difference. Herniation means that the part of the disc come out of place and pushing on the cord. Bulge means the whole disc moved out of its place. When this happens, usually get narrowing in the space, which cause more impingement on the nerve. And when this happens, it start grinding in the spine, and the circle just keep going until pain more, spasm, inflammation, pushing on the discs, and so forth. This is the problem that a lot of people neglected. A lot of people don't want to think about it, think that in a day or two it's going to get better. If I rest, it's going to get better. My advice, don't. If you have some pain and it lasts more than a week, check with your physician, get some imaging done, and treat it properly. But like I always say, Lily, we take our backs for granted.
Thank you. Are all spine conditions treatable, or are some conditions untreatable and only, you can say, there are some minor relievements? I'm not sure if you can say relievements. There are only minor things that you can do to relieve the pain or the condition of the patient.
Most spine conditions are treatable. Most of them are treatable, whether it's conservative through physiotherapy, exercise, or rehab, or chronic pain management, which is involve injections, or regenerative medicine, which is booming right now because people are fed and tired of management and they want to actually treat the cause and fix it, like I say. And if all this failed, surgery will treat this.
Thank you. What else would you like entrepreneurs and I guess people who are suffering from spine issues? What else would you like them to know about healing their spine?
Don't hurt yourself. Don't injure your spine. And it's pretty simple because all of us are having to know somebody in our family and in our workplace that have a back pain. The statistics say that 1 in 5 Americans, 1 in 5 Canadians has got chronic pain. In my opinion, we're all going to have back pain in our lives, whether it's going to last or whether it's not. And it's really treatable and it's actually preventable, Lily, right? By doing the same, a good form when we're lifting, by physical exercise. Sleep is very important. Drinking water is quite important. And taking supplements that you need, multivitamin, supplement your diet with whatever missing in your diet, vitamin D. All this actually prevent back pain. And I've seen a lot of people that were able to go back to their normal activity during my 20 years career with just simple habits like this. If we can change the habits, we're looking to prevent chronic pain. We're looking to prevent spinal pain, right? So it's really preventable condition. It starts as annoying, but it continues to be a bad way, and a lot of patients get their life actually ruined by chronic pain, whether it's an accident, whether it's sports injury, or whether it's just ignoring the fact that they have back pain.
Thank you. Tell us why such simple tips in terms of like getting supplements or drinking water and all those little things, why do they help? Because it doesn't make a lot of sense that they would help to heal your spine or to prevent that you get a spinal injury.
I absolutely agree. It seems very simple, but it's very effective. Number one, most of our discs in our back, in the back and in the spine, 80% of them are water. So you deprive this, you can see it on an MRI, and it's a condition called dry disc, right? So without that, it's very important to drink water. And the other thing is multivitamin. We need to take our calcium. We need to take vitamin D. We need to spend 30 minutes in the sun at least 3 times a week. All this help us to prevent osteoarthritis. It prevent the grinding in the back because it builds up the bones again. A good sleep reduces inflammation. Sleep is closely related to inflammation. If you don't sleep, all the inflammatory markers in the body flares up and eats up the spine. Let me add eating sugar as well. After age of 40, all of us will develop sensitivity to sugar, and our insulin sensitivity will go down, so we'll have insulin resistance, which increase the blood floating. That's why when we're younger, I can eat a large pizza, and I wake up next day feeling nothing. While in my age or after 40, you eat a pizza or you eat a chocolate bar, you feel tired, you feel lazy after it and bloated. This is very important things. And a lot of people like Dr. Peter Ataya and Andrew Huberman talk about it significantly, about inflammation and sugar, sleep. One of the things that they promote really heavily is a good sleep. Because without that, inflammation, where we will be susceptible for injuries, and our craving for sugar will increase. So it's a cycle, Lily, right? If you don't sleep, you eat more sugar, you crave sugar, you don't drink water, you dry up your bones and muscles and cartilage. 80% of your body is water. If you don't feed it with water, if you don't nourish it, you know what I mean? It will be dry and it will start grinding.
Thank you. Is it important what time you sleep in order to prevent spinal injuries?
It's very important, as I always say, to have a schedule and to sleep at the same time every day and wake up at the same time. It's very important to sleep in a good bed, good mattress, dark light or dark room. It actually enhances the sleep. You can go to a deeper sleep. You can release the cortisol levels, which is very important for preventing injuries in your body. So sleeping somewhere between 10 at night, 9 or 10 at night for 6 to 7 hours is really crucial to preventing injuries altogether. When I used to sleep little, Lily, when I used to work in emergency department, I was full of injuries. Every other day I hurt a joint. Every other day the muscle hurts. You get tendinitis, tendinosis, arthritis, right? And I didn't know why. Once I converted from night shifts, I used to work night shifts for 5 years, and it was brutal. And once this is stopped, I felt much better.
Thank you. Tell us about some other simple steps that entrepreneurs and people worldwide can use in order to reduce inflammation, aside from what you mentioned, which was very fascinating.
Diet. Diet in general is quite important. Entrepreneurs are really busy, and we're always running between meetings. My schedule is quite busy. I go to the clinic in the morning or most of the day, then I attend meetings at night. We go out. Sometimes there will be alcohol. So honestly, once I stopped drinking alcohol, I felt much better. And you can imagine you're having 2 or 3 meetings at night, you have a glass of wine with each one of them, it's over, right? So alcohol damages the tissues, stops the liver, which detoxify all the toxins that circulate in our system, including inflammatory conditions. So alcohol is quite bad for inflammation. Add to this a lot of carbs, all the bread that presented to you as an entrepreneur when you go for a meeting or whatnot. You don't know what's in this food. So Mediterranean diet is very important. Sleep is very important, and smoking as well. I used to smoke cigars. I used to smoke hookah at one point, and it affected me significantly with heart, lung, and even made me next day feeling like really foggy. So entrepreneur's life is not easy. You have to entertain people, you have to go out, you have to attend meetings, a lot of stress as well, Lily, which call it oxidative stress. You put stress on your body from all that work, right? The cells will be under stress. They will release inflammatory proteins in the body that will circulate and damage your back. So entrepreneurial life, you have to reduce stress, sleep well, and eat well. It's pretty simple.
Thank you. I saw someone mention that basically after 65, the likelihood of you hurting your knee or your spine is so big. And within that period of time, once you've hurt something, then maybe you only have 5 more years, because if you can't move because you have a spinal injury or you have like a knee injury or something, then you're immobile, and because you're immobile, you're not exercising, and because of that, like your entire lifestyle is, you could literally like die in 5 years. I saw someone talk about that. So tell us about what can people over 40 do to prevent that their bones become sort of like crumbly, so that they don't kind of get, you did mention a little bit before about preventing arthritis, or, for example, for women, one thing I'm worried about is osteoporosis.
Yep.
How does someone prevent osteoporosis or any other thing that could make the bones a bit more frail, so that you can stay mobile and strong in the later years until, like, let's say I want to be 100, and still feel really strong and be able to like walk for 20 kilometers like I can do now, let's say.
This is a great question, Lily. And one of my last lectures was about aging. And what if aging becomes optional? And I believe it's an optional now. So let me go back to the cellular medicine. So in the last few years, we looked closely at the cell in our body. And we looked at it and said, what is going on? Why do we age? I always had this question. And I always, when I was younger, asked my mom, when I seen my grandfather, after he retired, deteriorate quite significantly, and then he passed away. Exactly what you said. He hurt his back, he stopped moving. I remember him sitting in the chair all day long, watching TV, then he deteriorated and passed away, right? To the point that my grandmother used to feed him at the end, right? It is really important to look at the cellular level. We looked at it, and there is a huge gap in the function between before 40s and after 40s. After 40s, the cell slows down and start breaking down on a mitochondrial level, and its own inside functions slowly deteriorate. By age of 60, like you said, it's the second event will really slow down more than 60%. So we don't heal properly, our skin gets thin, our bones get thin, cartilage get thin, and so forth. After 60, that's why when you hurt yourself, it's very hard to get back to where you've been, or to back in shape or healthy again, and then you get deconditioned and slowly deteriorate. So to prevent this, we're hoping people to start early. We're hoping people to start even before menopause or before their hormones slows down. Look at the cellular level. We can prevent all this. We can do a test now for genomics and genetics and decide what you're going to get in your future. Are you getting osteoarthritis? Are you getting ADHD for adult? Are you getting rheumatoid arthritis, Crohn's, and whatnot? So this is the first thing that we do in our clinics. We test your genetics, we test your genomics, and we see what's your susceptible. Then we look at your habits, right? What are you doing in the habits? Are you exercising? Are you sleeping? Are you meditating? Are you reducing the stress generally in your life? And then we change the habits. We add supplements to slowly return the cells back. Peptides have been great to us in this matter, Lily. They can fix the cell and bring it back to your 20s. So your healing, your inflammation is gone. If we can maintain this, like you said, you're not only going to live to 100, you're going to live to 150. And we believe that people can live to 150 just by reducing this and fixing their cell. Osteoporosis is no different, right? We look at it, and one of the simple problems is the reduction in hormones, especially in females than males, but it happens in males as well. We all have this problem in our 40s or 50s that hormones decline. If we can optimize this and prevent the cells from breaking down, we will continue living normal and in our best form until we die.
Thank you. Is there a difference between men and women in terms of what they need to put in place to make sure that they don't get a spinal injury? Let's say, for example, now I'm 43, okay, and I would like to, live to 100 and also to be super active. And I'm wondering, versus, let's say, a man who is, let's say, 43 as well, would a man versus a woman, would they need to do something completely different in terms of their activities and their formulas and so on? I do understand that you would do the test, and for every single person, you would do a custom plan, a program. But let's say for people that don't have that option, is there anything they can put in place? Are there any like blanket supplements they can take that would generally help them to optimize their health, to live to longest?
Absolutely. Women's body is totally different due to the hormonal structure. I personally would believe, and this is from studies, increased collagen consumption, right? That's why you hear it a lot about collagen peptide, AT with collagen. Collagen is very important for women's hair, skin, bones, muscles. So collagen is one of the most important for women. And unfortunately, when the hormones level decline in their system, they don't produce enough collagen. So if you can supplement just collagen by having collagen-rich food and collagen supplements, this one thing will prevent them from getting osteoarthritis, skin, and whatnot. Add to that simple peptides that are available everywhere, like GHK copper, hair and skin will be as good as in your 20s. I did a trial on myself, on my social media, on Instagram. I took GHK for 30 days. Unbelievable results in increase in skin, hair, and it was just unbelievable. 2 supplements can make a huge difference, especially for women. And they call this, by the way, the natural Botox and fillers. You can imagine the effect of those, that it will keep the skin, the muscle, and the bones just healthy, just by collagen and GHK.
Thank you. Tell us about collagen, because you said you can also take it from food. Can you be more specific about what kind of food would someone need to eat in order to eat basically collagen?
A lot of vegetables, and I know that might sound hard, but bone marrow soup is full of collagen. Cartilaginous food is full of collagen, like the chicken cartilage. There is some parts of the meat that has a little bit fatty, that has a lot of collagen. And I know it's counterproductive for people who are trying to control their weight, but we're not talking about massive amounts, small amounts. Avocado is rich of collagen forming, celery. All this are just really rich of collagen supplements, just natural ones. But are you going to eat the amounts that will supplement this? I will suggest taking over-the-counter supplements. There are tea, there are soup now that can increase the collagen, but it is one of the best supplements that you can do yourself a favor for your joints and hair, skin, and even vision.
Thank you. What about NMN and NAD or other supplements that could potentially optimize the cellular health and then because of that prevent spinal injuries?
Generally speaking, we would like men and women to consume enough proteins, Lily, right? Like you said, with a simple injury after a certain age, we can all decondition and deteriorate. But the fact is, muscle mass and muscle power can prevent all this. If the guy who's 65 injured his knee is able to get out of the seat by continuing to exercise, build some muscles, increase the protein intake, that will definitely help them to stay healthy. A lot of people talked about it, and it's actually true. That's what's going to keep you going to the grocery store, picking up your groceries, going to banks, and going for walks. Muscle mass. So protein is very important, especially after age 35. Both of us, male and women, get significant loss in their muscle mass. With loss of muscle, people don't know that you lose some of the bone integrity and you lose some of the cartilage as well. So protein is very important. Supplements for that are very important, which is amino acids, as I say, are very important to increase the muscle mass and help everybody stay healthy.
Thank you. About amino acids, are you also recommending supplements, or are there particular foods they recommend taking in alongside supplements?
Most of amino acids are in food. Very few that we will need to take outside the food because it's just very hard to get them. They're really rare and they're really essential. And as growing up, we don't eat that kind of food. So some of them are really essential to take as a supplement.
Thank you. Tell us about the impact of, let's say, I noticed that I've been eating a lot of carbs, like a carb strong diet and not as much protein. What can possibly go wrong if I continue, let's say, having this kind of lifestyle where I eat not so much protein and very high on carbs? Is it that my bones become relatively frail and my skin, nails kind of start to suffer and start to fall, or I get kind of older faster?
It doesn't work like that. It doesn't work like black or white. But definitely, if you don't have the protein amount, and you think that you might not be eating a lot of protein, but we don't need a lot of protein. We need 1 gram per kilogram body weight, right? So a female that weighs like 50 kilograms, all what she needs is 50, which is honestly a chicken breast twice a day, right? Or if you're vegetarian, you can eat fava beans twice a day. So it's not really a big amount, but at least 1 gram per kilogram. If you want to push and build healthy, you increase it a little bit to 1.2 or 1.5 grams per kilogram. We have to watch for the kidneys as well, because too much protein is hard on the kidneys. Eating too much carbs will increase your inflammatory, right? And you're probably eating carbs because you might be under stress, whether it's physically or mentally. Under stress, we increase comfort food. The brain gives us the target or the signal that we need comfort food. When this happens, it increases endorphins and unfortunately increase inflammation as well. So you will feel that a little bit of inflammation, water retention, which is not good under the skin, not in the tissues that it should be. And slowly, inflammation will start set into joints, muscles, and the back. So we need a little bit of balance. But that doesn't mean that we cannot burn it by, like you said, walking 20 kilometers. So on the other hand, you're doing yourself a favor by walking and staying active. But the thing is, at one point, the fear or the concern will be that your diet will outrun your exercise. So you will eat a little bit more carbs than you're exercising, and the leftover will sit in your system and cause inflammation.
Thank you. For those that already have osteoarthritis or osteoporosis, or those that are prone to getting osteoporosis because maybe it runs in the family, is there anything that they can do? Because let's say they already have that, so that, I mean, it's not like they can prevent it because it's like they already have it. So are there certain measures that they can do to reverse the condition, or the condition is not really reversible? You can just make slight adjustments to the condition.
So far, we haven't been able to reverse it. We were able to stop it, slow it down, and maybe make it a little bit better. This is done through, again, sleep, diet, but peptides have had a great role into this. Peptides reduce inflammation by reducing all the inflammatory like cytokines, cause balance, and reverse inflammation, and actually doesn't suppress that like steroids or non-steroidal anti-inflammatory. NSAIDs is actually regenerate. So you will see that the bones are getting better, the cartilage are getting better, not to the normal state yet, but we're looking to have this. It increased blood flow to arthritic joints, so through forming new blood vessels, through increasing angiogenesis, increased fibroblast activity, so all the cells that goes in and break down the bones and cartilage is slowed down, and it really causes a lot of reduction in the inflammation, generally speaking, and regeneration. So it's not the end stage, but there are ways to slow it down, stop it, and reverse it to a certain extent.
Thank you. Is there any benefit to stem cells in order to prevent or to reverse the condition related to spinal injuries?
That's a great question, Lily. Of course, I've been working with PRP, platelet-rich plasma, and stem cells for a while, and I've seen incredible results. They reverse a lot of conditions, and we were able to help specifically autoimmune patient with it. Autoimmune with a lot of inflammation, the body's attacking itself through injection of stem cells in the area. It reduces the inflammation, regenerate the cells, and bring them back to their original state. So great results from them. And in my opinion, stem cells, exosomes, are the future of regenerative medicine and healthcare. It's like we're building an alternate pathway where we can actually treat the cause for almost all the conditions.
Thank you. Tell us why stem cells therapy works for spinal injuries.
They work because, number one, they reduce inflammation in this area significantly. So all the inflammation which cause muscle spasm, irritation, eats up the cartilage and the bones, it reduces immediately. It actually increased the balance between the cells that break down the bones and the cells that make up new bones. So it helps you build more bones and increase the integrity of the cartilage, increase the integrity of the bones in the spine. Number three, they reduce pain significantly around the nerves. And there are studies now that showing great results healing nerves back to its normal. Through stem cells and peptides, they've been treating patients with strokes, patients with severed spinal cords. So stem cells work significantly in this way. It reduces the inflammation, rebuild the tissues back, and we're hoping that at one point it will regenerate the damaged nerves as well.
Thank you. Have you used any like red light therapy or frequency medicine or any other hacks or modern medicine that works towards regenerating the spine that you can tell us about?
Red light therapy is quite amazing, and it actually activates the collagen formation, like we discussed. So the way we do it, we inject stem cells, and then we ask the patient to take peptides, and then we do the red light therapy to increase the flow of collagen, formation of collagen, reduce the inflammation, and then reduce the fibroblast activities in the body. So it's really a good complementary and adjunct treatment. We've been looking to hyperbaric, and we're trying to position it now, but we haven't really. We were not able so far to get our hand on a good study that will say that hyperbaric plus stem cells will work, and we're hoping in the next few months we'll get to a result with that.
Thank you. Are there any other therapies that you haven't already mentioned that you've used in order to regenerate someone's spine?
I've been using recently exosomes. So exosomes are empty cell without a nucleus in there, and we call it messenger cell, messenger's protein. It goes to all the cells in the body, in all the organs, and tell them to do what they should be doing, the normal function. So we inject billions of cells through IV, through the spinal cord, an epidural, and we inject them in the joints, small joints in the back and the facet joints, and the results are incredible with exosomes. Exosomes are the next level with stem cells, but on its own, we're starting our own study in our clinics about exosomes only into the spinal cord. And we're really excited about that because I think the results will be very complementary to what we're doing.
Thank you. Did you find that you had some patients that perhaps went to other clinics or have tried everything and couldn't get a result and came to you and managed to get an optimized result versus other clinics or versus other therapies or other things they have tried? And if so, could you tell us maybe 3 case studies of such clients you've had?
It happens all the time. Patients with chronic pain, unfortunately, are unheard. They suffer in silence because you cannot measure pain like blood pressure or blood sugar. The only scale that we measure is scale from 1 to 10. So people don't believe that they're in pain. So they go to other clinics and they try some of the conventional or old school chronic pain management like cortisone injections or steroid injection, whatnot, and they didn't get results. So they come to us and they're trying to look into something new. And the patient will sit in the exam room asking, I just need to know what's out there. And I've seen a lot of cases like this. I had a patient with a lot of muscle injury. He was bodybuilder, and he stopped his career due to multiple injuries. So he had Achilles tendon inflammation, biceps inflammation, triceps inflammation, and they decided to inject all this with steroids injection with no relief. We did stem cell on him, and after the 3rd treatment, we did 1 treatment a month for 3 months. And after the 3rd treatment, he was back in shape, was a full recovery.
Wow, that's fascinating.
It's quite incredible, Lily, to see this happening. He trusted us, and he said, let's try it. I've tried everything possible, physio, chiropractor. I don't want to go for surgery, but he really was really keen to go back to his activity and his sports. The other one is, I have a friend who had ACL in his knee joints, both joints, partially torn. We did the MRI. I said, let me try PRP with you. So he tried physio, chiropractor. He went to see a surgeon. He said, it's not fully torn. We cannot really treat it. Just go do physio and you'll be okay. Okay. So I said, just give me a try. So we did PRP 3 times. It didn't work. And then we did stem cells and peptides 3 times. Then we did the MRI. It was completely 100% recovery, Lily.
Wow, that is fascinating. And the third case?
A dentist. I have a friend and she was my dentist, and she had a vascular necrosis, which means that the head of the femur, which is the hip bone, blood supply gets poor, the bone gets slowly damaged and sometimes break. So she went to her, she got an MRI, she had a lot of pain from standing as a dentist, and she went to an orthopedic surgeon, said, yeah, you need surgery. And she was in her 30s. So I got a call from her, said, can you do PRP on me? I said, I haven't done it before on a case like this, but I guess if it doesn't help, it's not going to hurt. So we've done it, and it's been 7 years, 100% recovery. 7 years. She comes twice a year. We do injection in both hips through PRP and stem cells, and it healed this, increased the blood flow to the femur. The vascular necrosis is completely gone, and she's been active, working professionally, long hours a day, and exercising.
Thank you. Tell us about entrepreneurs who perhaps work on, they sit on the chair all day long and they have a relatively sedentary lifestyle. They don't lift weights. They don't walk too much. They're just like in and out of the car all day long. You look at them and, they have like what appears to be a fit body just because they naturally are kind of like gifted and they're not overeating and so on. What can someone like that do to in terms of like small steps so that they prevent spinal injuries aside from what you already mentioned? Is there anything like stretching or lifting weights, or I don't know, because the reason I am asking you this is because, for example, I don't lift weights and I don't like lifting weights. Having said that, I had one guy on my podcast and he was talking about how over 40, it's like so important to have to lift weights because it helps with your bone density and and you can tell us more about that, your personal opinion about small steps entrepreneurs can do to make sure that they don't injure themselves, especially sedentary entrepreneurs.
Not everybody is willing to lift weights. It's not the end of the world, but just stay active. The way I would say it is every hour you need to do certain exercises. So something like McKenzie exercises, which is basically just moving your neck, right? Moving your neck, moving your chin, because all this tension in the neck at one point will cause arthritis in the neck. Sitting on the computer all day, doing some air squats, right? Doing a little bit of push-ups, sitting and standing, bending, extension. The main exercises that I advise my busy patient is McKenzie exercise. They're good for the neck, for the hips, and the lower back. If you can do those few times a day between meetings, that would be incredible. With definitely a walk that will not supplement from walking. You do walk, you do a bike ride, you do fast walking. You wouldn't need much of a weight lifting if you really don't have to. Yoga is pretty good as well. Zumba is quite interesting and great results from it. Sauna is quite important. In the last few years, I know a lot of people went into the cold plunge. I'm one of the chickens that don't like sitting in the cold or sitting on ice. And I looked closely in the sauna. Sauna improves vitality and protects 60% of all cause mortality, Lily. It's just so good that increase the flow to the muscles, the bones. So entrepreneurs, they will be able to go to a sauna 3 times a week, sit there for 15 minutes or more with those exercises and a good walk. You wouldn't need more than that.
Thank you. Like today, just before the podcast, I had plunge in the pool, and the pool is ultra cold. It's in Portugal right now. And it's literally like a Tony Robbins, how I would imagine the Tony Robbins pool is, like icy kind of cold, like the kind of cold that if you wanted to cool your beer in, that's the kind of cold it was.
Oh, wow.
And that's not the kind of the swimming that I like to do, but it was pleasant. And I did notice an improvement in my skin. So tell us about the benefits of plunging in cold water for your skin and for your, not for your skin, for your, for preventing spinal injuries and for reducing perhaps inflammation. Does it work for that?
It does. It does. What it does is it shifts the brain and the body attention from the inflammation and to actually a survival mode. When you do this, the blood flow will go to the vital organs, so your brain. So you wake up quite nicely to the liver, right? So the liver start working faster and harder into detoxifying a lot of toxins in your bloodstream. That includes inflammation as well, right? It helps activating the brown fat that around our spine. So brown fat is very important for vitality and longevity. And we only have very little amount when we grow up. We have a very small amount in the back of the spine, in the back of the abdomen, and a little bit in the pelvis. But this brown fat is very important as well for longevity, right? It improves collagen formation because it's, as I said, it slows down the body from breaking down itself inflammation, and goes to the vital organs, which help with that.
Thank you. Tell us where entrepreneurs can connect with you and perhaps come to see you in your clinics.
I would love that. I'm very active on social media. So Facebook, Hany Damian, Instagram, Dr. Hany Damian, our clinics at Pain Care Clinics or Presentia Healthcare, but also my website, drdamian.com. Love the challenge, love interacting with patients, clients, answer questions, because I know it's a little bit of cowboy land now with all influencers pushing for stuff, but people really need to look for a physician that understands and knows what they're doing. So really happy to interact with anybody.
Follow me for more interviews with world's most innovative health change makers to live your healthiest life ever.